it's Kristen here at UT Southwestern. Thank you so much for joining our chat on nicotine and tobacco cessation. I am excited to be joined by clinical scientist Dr. Simon Lee and Maria Grabowski, who is a program manager here at the Simmons Comprehensive Cancer Center, as well as an oncology nurse. As usual, do not forget to like and share the conversation. We're talking about a really important topic today, and we want to make sure that we get as broad of reach as possible. And also, be sure to ask questions in the comment section. Now is a great time to get those started. We can't comment on really specific patient privacy issues, but this is a pretty general topic, so hopefully we'll be able to help most of your questions. Anyway, thank you both for joining us. Thank you. I think it should be a fascinating topic. I know it's a big deal here in the Simmons Cancer Center. And so with that in mind, I want to start with you, Dr. Lee, and that, why did the Simmons Cancer Center launch a nicotine treatment clinic in the first place?
So UT Southwestern has been addressing tobacco cessation, nicotine cessation issues from a treatment perspective, across our health system for quite a long time. And more recently, we've developed an inpatient program that's been quite successful in reaching patients if they're hospitalized here. The challenge, I think, has been from a cancer center perspective, where patients who come to see us at Simmons are so focused on their cancer and their treatment team is so focused on their cancer that often we've overlooked the issues of tobacco cessation. Right. Nationally, the National Cancer Institute has been really interested in trying to address this gap even across NCI-designated cancer centers throughout the country. So part of the drive behind this initiative is a much bigger push from the Beau Biden Moonshot program, which I think many people will be familiar with. But we tend to think about that as the focus on developing treatment and research for new cures. Where the Moonshot was really important is that it also had a focus on thinking about how do we bring evidence-based interventions and evidence-based treatment that we already know works, and making sure it's implemented across the country in the communities that really need it. And Simmons wanted to be a part of that. So here it's about making sure that guideline-based nicotine cessation programs are available for cancer patients even as they go through their cancer treatment.
Gotcha. That's a perfect segue. Do you want to tell us a little bit, Maria, about the smoking cessation program that we have here at UT Southwestern?
So we have a few dimensions to it, and we do encompass and call it nicotine cessation, fully appreciating that even though the tobacco product itself contains the most harmful ingredients that impact lung and different cancers, we're keenly aware that the nicotine itself also has health risks to individuals, especially those undergoing any surgeries, those who may have high blood pressure, hypertension, as their own, how their body is functioning at that point, or those with diabetes or peripheral vascular disease. So it has a lot of rippling implications. With all that said, we name it nicotine cessation, so trust all are welcome. And with that, we have a physician provider who's dedicated this as his subspecialty, as well as a group of us who have various health backgrounds. As mentioned, I'm an oncology nurse by background, and I'm extremely passionate about prevention and even survivorship. So if someone's been cured through their treatment, then I want for them to have the healthiest quality of life possible. And so with that, some of the tobacco and nicotine products can detract from that. So we have a physician provider, and within our team, we have certified tobacco treatment specialists, and that's actually a national certification. So we've dedicated a lot of our energies to ensure that we're as current as possible. If a patient would come to us, what they'll experience is they'll spend a portion of their time with the physician himself, and they'll then be able to sort out which pharmaceutical agents would be optimal. Afterward, then they have a chance to spend time with us as the treatment specialists, and what we provide is education and resources and essentially support. Whoever is using nicotine, we are aware is highly addictive. If anyone could stop immediately, abruptly, they would have done that without us even needing to hear about them. So we extend a lot of patience, a lot of information, try to understand what the person themselves is voicing as their own private barriers, that they can be comfortable with us and we can help guide them through that path toward a healthier lifestyle. Additionally, we do host a group, and that is where any community member, and if people want to come anonymously. So for instance, if they are an employee somewhere and don't want to disclose to their employer that they use any tobacco, nicotine product, they can come and experience that with us. And all of our methods have the premises, the basis of the American Lung Association's Freedom from Smoking. That's a gold standard evidence-based program that's been around for decades. And then the American Cancer Society has a phenomenal program for those who would like to tackle this habit, this lifestyle a little more rapidly. And we incorporate that as well, in addition to our own set of skills as we interact with that group.
Wonderful. So we'll try to include as many of those links in the feed as we can. We did have a couple questions come in. Before we get to them, I know you have one here from Christy about quitting smoking, one from Cece, but I'm curious, we've talked a lot just now about what our program entails. What makes this part of getting care at a comprehensive cancer center?
Well, thank you. I mean, I was going to jump in because I think what Maria is describing really sort of ties in with that. Tobacco use is very complicated. As she pointed out, it's addictive. The challenge for many cancer patients is that they're really worried about their cancer treatment and what's happening with their oncology team. Part of the comprehensive piece is recognizing that we're really concerned about the whole patient here, not just their cancer disease, not just their tumor or the cancer diagnosis that they're living with, but making sure that we're understanding what are the needs of that patient as they go through a whole process. Most of us, I think, are very aware of the public campaigns about smoking, that it tends to be about smoking to prevent other illnesses. But then we miss that other piece, that patients who do have diagnoses also need help to deal with how do we help them reduce their use or indeed to quit.
Good point there.
Do you mind if I just add a little to that? So in terms of it being a comprehensive cancer program, what we also recognize is just as if a patient came here, they could have the advantage of meeting with a dietitian who individualizes their care, or a social worker, and it's just part of their experience of being here. No additional out-of-pocket fees.
Wow.
And that is what we offer. So the private appointment clinic time a patient might choose to experience with us, again, there's no out-of-pocket fees. That is free of charge.
Great.
Because we fully appreciate that anyone going through treatment, that is scientifically proven they will have better outcomes. If it's a radiation therapy treatment base, or if it's a surgical recovery they'll need to experience, or if they're on any of the systemic agents, and we know that they will do better through treatment and they will thrive much better in their survivorship role. We also extend it to the family members too, that I want to just emphasize. So for anyone,
we got to tackle some of these questions.
Sorry.
So no, you can finish.
No. So again, because we know the secondhand smoke is another feature to someone's health status. So if the patient is here and it's comprehensive care we're trying to offer, we welcome their family members if they're struggling with their own themes.
Good to know. Thank you. So we have a number of questions that are coming in. I want to start with this one, and this would be for you, Maria. Once someone quits smoking, can the lung damage from previous years of smoking be reversed?
Yes. So what statistics seem to show is somewhere between 5 years and 15 years that your pulmonary status, your lung status, will revert back as though you had never smoked. And what we know with that is if someone already has a certain degree of damage, then we know with certainty they're going to keep improving and keep improving. But what we also know is that if someone has minor compromise and then they stop, that within about 5 to 15 years, and we think 15 years is that threshold.
Okay, 15, wow. So
can I jump in, because I think that's an important question, is that there are clearly long-term benefits to reducing tobacco use. In the short term, though, anything to reduce or to quit makes a difference. And I think particularly what's important for the cancer patient community is understanding that if you're getting treatment here for your cancer, whether that's a surgery, radiation, or chemotherapy, or a combination of those, continuing to use tobacco actually impacts the efficacy of that treatment. And what we've heard from our oncologists is that they really want to make sure that patients understand that. But oncologists are also experts in treating the cancer. And what we've done is bring in Maria's team with Dr. Bayless to be able to provide the expertise specifically in nicotine cessation, so that you're seeing really experts all the way across the spectrum of your care here, so that the oncologists have partners in this. And that's the challenge, because I think for many patients, they may have questions that they don't know who to ask or how to ask, but they already have a list of questions that they have for their oncologist.
Right.
So they may feel like they don't have time to focus on that, and we're trying to address that problem, again, comprehensively by bringing those teams together.
Makes sense. Sounds like a great place to be if you need those resources. So we have a question actually for you, Dr. Lee. Anna asked it directly. She said, what are the trends with juuling? Do you know about J-U-U-L-I-N-G? Maybe I mispronounced
Hi,
that.
Anna. So Maria may have some more information about this. So the juuling question, so that's a specific technology for vaping, in effect, that has actually seen really high uptake because it's a very small device. It was slow across the country, but then sort of picked up really quickly, and there's a lot of brand recognition, but I think this falls in the category of vaping.
Okay.
And we have some real challenges there, because many people feel that when you have a smoking ban, say in public places, that vaping doesn't count as smoking, and so it may be safer for them and for other people. And there's a lot of debate in the literature about whether it's effective harm reduction, because it is enabling people to reduce their use. The challenge really is, from my mind, is that the FDA doesn't really monitor the ingredients of everything that goes into those vaping technologies. So I don't know what else is in there.
Yikes.
So that's the real challenge. The other question, and we have colleagues here who are studying this in the Cancer Center, Dr. Kim Sterling for the School of Public Health, has been focusing on the way that marketing has been targeted, particularly at younger people.
Right.
So there's sort of those questions that I think people are still looking into.
Interesting. Do you want to add anything?
What I would just add on is, when we have some individuals who have a very heavy cigarette habit that they're trying to harm reduce and taper off, they may turn to some of these other products. For those who turn to the Juul, what we specifically know is that the amount of nicotine per inhalation is much higher than they would experience even with one cigarette. And so that has the additional health risks of just having those high hits of the nicotine, which also continues the whole pattern of addiction, because once more, it's de-emphasizing the harm reduction, and the usage is actually accelerating the amount of nicotine.
Interesting. Great question, Anna. Thanks for bringing that up. I wasn't familiar with that term before. Here's a different question from Christy, and this is one that I think is fairly common. How can someone talk to a family member who knows the risks of smoking but isn't ready to quit? Do you want to start with that, Maria?
We are keenly aware that any of these habits impact the family. And what we also know that out of sheer love, there are different messages you can extend to someone who has this habit. What we also know is that sometimes that can raise a significant amount of anxiety, or if that patient knew how to stop, they would. And so we actually do invite family units to join in on one of our sessions and let them know that often the best thing is to make certain the patient or the individual using, they have loved ones around them who are supportive, who will be there as the listening ear or whatever that includes, or even a diversional activity, but to keep reminding the individual to stop. That rarely is effective. It actually either continues that pattern or sometimes accelerates it, because now the person feels, we call the expression deer in headlights.
Right, they feel aggravated and irritated, and they're constantly being...
And if one of their triggers to use nicotine is anxiety or irritation, then that just bumps that right back into that moment, and they're using more.
I think there are a couple of things that are important for family members to keep in mind, and for patients themselves. one, tobacco addiction, nicotine addiction is really challenging to deal with. What we see in the longitudinal data over years is that a lot of people who use will try to quit. Most will fail their first quits.
Right.
And we talk about quit attempts, and that's really what people have to focus on, because it's not, I think sometimes we can really put too much energy into the idea that I'm going to stop now, and not recognize that it's both a psychology and social behavior that's very complicated. So cues around, for example, going out for an evening and alcohol or dancing, but also that it's physiological and biological, and that craving for nicotine is incredibly powerful. So it is hard to stop. So part of what the services that Maria and her team provide is that ongoing counseling to help people work through what it's like to try to quit. But I think it's important for people to recognize, and particularly for family members who are trying to support their patients, is that I think it's okay to tell people, I know this is hard, it probably won't work the first time, but the point is to try and keep going, and anything, even cutting back one cigarette less a day, the more you can reduce, the more of an impact it's going to have on everything, not just your cancer treatment, but also any of just the cardiovascular impact on your heart and blood system.
Right.
That really is going to affect everything else. And I think about that a lot as I get older, that it affects everything, not just the diseases you may be dealing with.
That actually got right to this other question we have was from Cece, and what advice do you have for people that have tried to quit smoking, that have had those attempts, and want to try again?
Right.
What should they do?
And we explore that at length, in fact, because we want to hear about their past quit attempts. We want to hear what length of time they were successful in just breathing fresh air, but then also which strategies did they use on the previous ones, which worked, and which strategies did they use, which failed. And then we try to build on the positives and keep reminding them they've done this once before. As Dr. Lee mentioned, that it often will take, we know it takes about sometimes 5 prolonged quit attempts before someone is completely nicotine free. We do have our champions who stopped abruptly with just, our social support that we're offering, our educational product, our pharmaceutical agents, we give it to that individual, and they're done, they stopped. But that's not the usual person that's using nicotine. It's
and
rare.
what you found, Maria, I think, part of the big picture of having a cessation program is there are different modalities that we can offer to patients, right? Where some people want more counseling, they may want a medication prescription, and that's what you and Dr. Bayless work through, is what really works for that individual patient at that point in their process of trying to reduce or quit.
So a couple just nuts and bolts questions. We have one in here from Ellen. How long is the tobacco cessation program? So can we provide some details about length of time and what it requires?
So it can be as long as one needs. Okay, the standard method, if someone does not have a strict deadline that they must meet. So for instance, if they need a certain type of surgery, they may be told they must be X number weeks, months, days free of nicotine. So if they have the luxury of time and they're not ready to stop today, but know that they want to stop, we imagine it takes about 8 weeks to kind of walk them through, and we remain in touch with them weekly. We invite them back to the clinic for an appointment every other week. Then also, what we know is we try to follow individuals for 12 months. And so if we've had an opportunity to meet somebody, they've done really well, then we want to inform them that in about 3 months from now, we want to touch base with them. And then 3 months later, and we just want to stay in touch and remind them we're always here if they've had a rough moment. So, and for other people, sincerely, they have stopped, and we hear from their providers, they are not using. A couple of our providers check blood and urine on these patients to be sure they're not, because they want that person optimally healthy for treatment, and they really have stopped.
Wow.
And then we have the others who we stick with them in the long haul.
So why is tobacco cessation important particularly for cancer patients and their families? I believe this is something that you've done some research in, Dr.
Sure.
Lee?
Well, in tracking the patterns that we've seen, and particularly in talking to our oncologist colleagues, it's important to think about what's happening biologically in the use of tobacco. So the body is not just taking, let's stick with cigarette smoking because that's, I think, the easiest example. There's clearly the issues of smoke inhalation, right? So something is actually burning and you're inhaling smoke and it's damaging your lungs mechanically. The other issue is there's all the chemicals in that smoke, plus the issue of nicotine. So we immediately tend to think about smoking as being bad for your lungs and therefore bad for lung cancer. But when you smoke, it has to go somewhere, right? So your body is metabolizing all of that burned product and the smoke and has to get rid of it. So for example, it's going into your blood system, it's affecting your digestive tract as you're eliminating chemicals from your body, and so you have a possibility of things like prostate, it will affect prostate cancer or urologic cancers. But we often don't think about that. We know that independent of that, the effects of treatment are not as strong, and that affects people both in terms of affecting the processes by which radiation can attack the cancer, and so it weakens that. And then there's a challenge, and obviously I think Maria talks about surgery. We know that it affects wound healing. So many of our surgical physicians are really concerned about how they can get people off of smoking before they actually intervene surgically.
Right. There's just one theme that I did want to interject.
Absolutely.
So when you're using the inhalants, you are actually deoxygenating yourself.
That's right.
And that's what correlates heavily, especially with the radiation oncology patients. But in addition to the deoxygenation process, it vasoconstricts, meaning you have blood running throughout your entire body. But at your furthest little digits or at a wound, then those areas are working extra hard to keep the blood supply fresh, the oxygen fresh, and nutrients, also eliminating waste product. But when it's clamped down, it does not work as efficiently.
Gotcha. Okay, we only have time for one, maybe two more questions, so we're going to take these really quickly. Here's one from Anna, and then we're going to do our last question. What are the most common types of cancer that can stem from tobacco use?
So we obviously think about lung, but there are several more. I tend to think about it as all of them. Not as much causally, but also as we've talked about because of treatment. If you're being, no matter what cancer you're being treated for, smoking has deleterious effects. Maria, do you have more thoughts on the specific cancer sites?
So what we are now seeing is in pancreatic cancer, actually, that's starting to correlate, that we can see the trending of that. Kidney cancers, because as Dr. Lee mentioned, when you are inhaling something, it's not just going into your lungs, you're metabolizing whichever byproducts there are. So the kidney cancers tie in with that. And then I do want to mention just directly the oral cancers, because that's where you're getting that direct exposure. And in the event, your tissues already have experienced an environment that's caused them to become malignant. If you keep adding the tobacco product onto it, then that person's susceptible. And that might be a very different profile than if I was using it, because my tissues there aren't vulnerable or don't appear to.
And I think the oncologists are concerned also about recurrence. So if we successfully treat you, continued tobacco use, nicotine exposure impacts the likelihood of recurrence of your primary cancer as well as secondary cancers later on in life. So it matters as a survivorship issue.
Okay. So we've got one more question. We started with you, Dr. Lee, so I'm going to end with you, Maria. Somebody's decided that they want to quit smoking or they need to quit smoking. What's the first step?
Well, I would recommend if they would reach out to someone like us, because we are very credible. And what we are offering is scientifically evidence-based care. We are only wanting to encourage and offer what has a proven track record. And so, again, it's essentially free of charge. And I believe that it's also a very unique offering in this Dallas area. And we want everyone to stay as healthy as possible, preventing any malignancies, and definitely if they already are diagnosed with something, we want them to soar through their treatment and enjoy their life.
So mechanically, you can call the cancer answer line.
Yeah.
Here at Simmons. There is also the Texas Quit line. And I think those things can work together if you want to come see Maria and her team in person, but also that 3 o'clock in the morning phone call that's really useful for people who get cravings. That's what the Quit line is there for, and that's available throughout Texas.
So we will share the Quit. I think we already shared the Cancer Answer Line number. We'll definitely share the Quit line. And we are out of time for today's chat. I do want to thank everybody for joining. This chat, as all of ours, will be available here on Facebook as well as our YouTube channel later this afternoon. So if you have friends who aren't on Facebook, send them the chat on YouTube so they can watch it. Most importantly, though, I want to thank both of you for coming and answering all these questions. It's been great to have you.
Thank you, Kristen.
Thanks for the invitation.
Absolutely. So I hope everybody has a wonderful afternoon, and we will see you next week.